So welcome back to Rebranding Menopause. We are here with my co-host, Dana Persico, Sharon Grasso, and the most incredible gynecologist and menopause specialist, Dr. McNally from Northwell Health. We are so excited to have you here
Superwoman
again
of menopause
for
treatment.
the third episode with you.
Yay!
Yay!
The repeat.
Yeah.
Love it.
Now listen, I thought maybe we could talk about something a little bit different than hormone replacement therapy, blah, blah, blah. You 50s.
Beep, beep, bleep, bleep, bleep.
Anybody want to talk about that?
I'll talk about that all day long.
Like, I don't know what happens to us, but let me tell you, for any woman who is, a little bit upset about going through menopause or getting there, it's such a beautiful thing to go through the fuck you 50s. It's so freeing.
well,
I love it.
you're just over it. You don't care. What do you say?
No,
Let
but what
them-
happens?
let
Is it a
them.
mental thing? Like, what do you think happens?
So we know we talked a lot about physiology and hormones, but part of it is that we become more confident and secure in who we are.
Right.
Right? We've established that we can be career women if we choose. We can be mothers if we choose. We really owe no apologies and are just continuing to light the way for those of us behind, right? We want our daughters, grandchildren, nieces to be successful. Mm-hmm. So I think part of it is being comfortable with what you can accept.
Right.
And really not letting the little things get to you. And that is work.
Right.
So you've had decades of practice.
Yeah, I mean, I find myself like any kind of drama, I'm like running the other way. I'm out with drama. I am proficient at saying no, which was a big thing. Huge thing in my life.
People pleasing is a big thing when you're younger. Yes, you want to fit in. You don't want to say no. You care how, not that I don't care how people feel, but you care how everybody else feels. You don't want to let anybody down.
Right.
Now you're 50, you're 50-something. You've raised your kids or you've created your career, built your home, and now I am who I am. Yeah. This is it.
Did anyone see the Jerry Seinfeld special on getting older?
No.
Oh my God, it is so funny. He talks about how the fact that, when you're in your 50s, you get an invitation and you have to reluctantly sometimes, say no or even go because you're out of guilt. And then when you get in your 60s, you just say no. And then in your 70s, you don't even respond. You're like, I don't even respond. Or when he says, oh my gosh, turn around, you have to see that. He's like, I don't want to turn around anymore. I've probably seen that before a million times.
But it's that comfort in your skin.
Yeah.
You're comfortable in your skin.
It is.
Because it's been your skin for a while.
Yes.
It feels good though. It actually physiologically feels good to just be like, you know what? It's all good. It's okay.
Yeah.
It's okay to go to bed at 9 p.m. It's okay to put your pajamas on when you get home if you want to. It's okay. That's what I do.
Great.
9 p.m. is the new midnight.
That is true.
Yeah, and you think about it, if with everything that happens with the menopause onset, you're coming out of this roller coaster that can be so emotional, highs and lows, reacting emotionally, not because that's who you are, but because maybe you just are, right? And then so you get to the other side of it. I'm 58, and I feel like at 58, I'm very comfortable with everything. Yeah.
No, you're not.
Yeah, I'm going to be 59 very soon.
What?
Yeah.
You look so
Well, amazing.
Thank
Happy
you.
early birthday.
Thank you.
Wow.
And I feel very comfortable I physically feel comfortable. I don't know if I can even express to you guys what that means, but I think some of it's a rite of passage. Mm-hmm. Some of it's what you said, having a career, having children, the kids are all doing well, and you just kind of sit back and you're like, wow, it's all good. But you came out of that
you went
storm
through your changes.
of the change. When it hits, like you said, how did you describe it? It hit you.
I got punched in the face.
Yeah, so, people need to pay attention to that, and they also have to go easy on themselves. I think women have to really, say like something's happening and I'm not, superwoman, and I need to go to my doctor and seek professional help to say, how do I handle this and control it? Because it is controllable.
Yeah.
And when you need a minute, take a minute.
Yeah. Right.
Like we said before, we're all three of us are going through menopause in a completely different way, which is great. Mm-hmm. I was going through it naturally and just started, a short while ago. You have not been on HRT and you started right away because of a complication that you had. But I think getting there to the same place is so important to have that that feeling of I'm good with the results that I have and the way I'm managing my own health. And I think that it's also very important for people to know you manage your own health, and you're the only one that knows that you feel good or that you don't feel good. Right. When you go to your doctor year after year and you're like, I don't feel right, it's not me. That's not normal. You have to go to someone that's going to recognize that, like you did.
And part of it, what you said, is that up and down. So that perimenopausal transition where the hormones are up and down and up, that's sometimes worse. So we talk about how menopause is, but it's not all bad.
Right.
Right.
So you're not buying pads and tampons. You are in that confident stage. It's just different. So knowing that that roller coaster is gone, many women do feel a lot better.
They used to call it going through your changes, right? Which doesn't necessarily mean you're changing into something bad. That
I don't
negative,
like that.
That
Right.
negative connotation.
Agreed.
When I stopped getting my period after the partial hysterectomy, I missed that part of my life because we all know when your period is done, there's this week or so that you just feel incredible because everything must be really balanced. Mm-hmm. And I was like, wow, I'm not going to get that feeling anymore. So, find it in a different way. You get your hormones back in sync and you work out, all these different things.
I was never that in touch with myself, Dana.
Yeah,
you must have been
I'm
very
a Pisces,
in touch with
I'm a little,
when it
I overthink
I was
things.
like, good, I'm done. I never had easy periods. We were talking about that before. I suffered with endometriosis. I had 3 in vitros for my first child. Had my second naturally just like that.
Sure.
And let me tell you, when my period went away, like, see ya.
Yeah.
Maybe I had a hot flash. I'm sure I had that, but it was never severe enough. I'm lucky in that way. I did my hormonal suffering for decades
prior
before.
Right.
So
when you went through a lot if you had in vitro 3 times.
I had surgeries for the endometriosis. I had, we were discussing, I had been on Lupron or Depo-Provera that I had been put on because my periods were disabling for me. As a woman building a career, I was a single mom for decades, raising children, disabling, crippling, the cramping, the pain, the headaches. And
So you said, see ya.
so when I went into menopause, when I was on, that's literal chemical castration. It's not good for you. Like, don't try this at home. Right. But when I was on, in my 30s, stopped my period. And I felt great when I didn't get my period. So when I went into menopause, there were a few, but it kind of stopped like a faucet. Like I had some, but then when it stopped, I remember I was going to a party. And I was in a gown. I was going to a black tie. I think you must have been there. And I went to the bathroom, and I was like, now? Really? And it was heavy for like 4 hours. And I never saw it again. And I never missed it, and I never cried for it. See ya.
Yeah.
There's so much to unpack here from a medical perspective. So I'm so excited. So we're going to break it down that everybody's experiences are different. So speak up for what you have.
Yes.
When we talk about hysterectomy, right, the anatomy that a woman needs to know is so important. Your cervix, your uterus, your tubes, your ovaries, the vagina. They're separate parts, but all connected.
Do we have a diagram of that, Jay?
We're going to have to
that up?
flash something up that's totally appropriate. So when a woman has a partial hysterectomy, that's the uterus. That's where period blood grows. That's where, if you choose to have children, that's where that area is. Your ovaries, which are next to it, are your hormone centers where your eggs live. And that's where, again, estrogen and progesterone are mainly made. And that time where you're just about to ovulate, especially for our younger audience, is when you feel that euphoric, I feel amazing, I can conquer the world. So that's where your ovaries are, your uterus. The cervix is the bottom part of the uterus. So for a partial hysterectomy, it really is just taking up that top piece where the period is, where a baby would grow. The cervix is left, and for a total, that means the uterus and the cervix are taken out, those 2 parts that are connected. Mm-hmm. Your tubes don't really have much functionality from a hormonal perspective. They're the conduit to allow eggs and sperm to get together if somebody wants to have a baby. So I think it's really important to kind of say, for women that have their ovaries removed during that hysterectomy procedure, that's where immediate surgical menopause happens.
So there's an option, or sometimes
So
there's not
can
an
I tell
option.
you what
We're like,
happened?
what?
They know this story. So the night before the surgery, it was going to be a full hysterectomy. I had been with my husband. We're now together 10 years. We were together just over a year and a half. My husband's 10 years younger than I am. And now I'm faced with a full hysterectomy. And I started reading, thank God, because it dawned on me, the doctor said my ovaries were good. The next morning when I got to the hospital, I said, we're leaving my ovaries. He was not happy. He said, I really don't recommend doing that. I said, but you did say, and my husband was there, I said, just correct me if I'm wrong, back me up on this, that my ovaries were fine. And my husband said, yeah, I did hear you say that. So we left my ovaries.
Why did he say he wanted to remove them? What was the thought process behind removing them?
I
If
don't,
they were good?
I don't really know. I don't know.
There's a pendulum that sometimes swings in medicine across all fields, where this is the theory and thought behind it with data, and then it shifts back. But your tubes actually may be the source of some ovarian cancers, may actually not be ovarian primary.
She didn't have cancer.
Right, but I'm just saying in terms of why would we take out certain things, so I can't speak
No
to that.
familial history, but I just decided, you know what?
And good for you for that.
And it was the
a
best
big deal.
thing that I did, because as much as I had the onset of menopause, how much worse would it have been if it was a full hysterectomy?
Right.
I can't imagine.
Right, so your ovaries were in, tubes are separate, uterus, cervix, kind of all of that anatomy piece. And we were talking about like advocacy, right? So women often will say, I'm sorry, how many times a day?
Right.
And I say to my daughter who's 10, well, why did you say you were sorry? Are you really sorry for something you did? Right. Because I don't want her to get into that role in her life that, oh, I'm sorry. Why are you sorry?
And it does something to a woman's self-confidence.
Yes.
A woman should not apologize all day long
Correct.
for something that never occurred.
Yeah, that's really
And
a
I
big
tell the
one.
young women that are on my team members, you don't have to apologize when they'll say, like, I'm sorry for interrupting you. No, it's okay. You know,
Right.
you needed to talk to someone about something. You don't have to apologize for that. So I agree with you completely. Advocacy, patients know themselves the best. And it's okay to say, I want to talk to you about this, to your doctor, and I have a different outcome I'd like to see.
I think that's so important. And I think the worst thing that I see is that white coat syndrome, where patients are afraid to challenge, if you will, whatever the doctor says
Right,
is
absolutely.
what they're doing. And it drives me crazy. I mean, doctors are amazing. You've gone through all the schooling, and of course, you know so much. But a good doctor, I feel, should be open to having the conversation. You want a comfortable patient. You want the person that's undergoing this
And
to
you just
understand.
explained more about the surgery that I had than the doctor that did the surgery, by the way.
Right.
Yeah.
And how long did that take, right?
Right,
This
2
is
minutes.
not, there's something called relationship-centered communication, which I think is great for families, for relationships, but we implemented at Northwell in many disciplines where the patient is the primary. This is what we do. We're not doing it for me. I'm doing it for you.
Right.
And when somebody walks into an office or they're for a telehealth to start, what brings you here? Open-ended. Give me your list. I will do my best. And then setting parameters. I may not be able to fix everything today. I may not be able to fix it, but we can start to put the pieces together.
But that makes what you just said, it would make me feel so much more comfortable because it says I'm here to hear you.
Right.
I'm here
For
to
you.
help you.
That's the reason why I got so emotional when we got off our conversation when we had our telehealth, is because I just started crying because I knew that someone heard me and I was hopeful. And I think that's what people need to feel. They need to feel that hope, especially when you're going through something where you're not yourself and you've been yourself for 55 years. And now you're looking in the mirror and you're like, who the hell is this person?
It's very isolating.
It is. And for someone like me who is constantly, trying to be, I don't want to say the life of the party, but like
You're
happy,
very upbeat always. Yep.
and not to feel that way and almost have it to be a forced thing. Okay, this is what my personality is, so I have to keep going. In a way, it does help because it just like snaps you out of it. But
It's exhausting.
It's exhausting. It's exhausting. Yeah.
And for many of the providers that we've built up through our menopause and midlife medicine program, they understand this, right? Give me the list. give it to me. We will do this together.
Yeah. And I think another thing about being together with your girlfriends and boyfriends, whoever it may be, is that I know we've spoken about this and how important working out is and lifting weights and just movement in general. But I will say that going to a class every morning at 8 a.m. and being with my girlfriends and having that conversation every morning and having the accountability can be life-changing as well mentally, because everybody needs that. You know, we can be so isolated right now with our jobs and our homes. That 15, 20 minutes alone with your girlfriends every morning, that's everything sometimes. Oh, yeah. You know, you have that commonality, you have a smile, you have someone that's so happy to see you.
It's your time to be you.
Yeah.
To just be you.
Right. And I say that to a lot of young moms that I talk to. I don't ever lose, like I call myself Ingrid Crumhull sometimes because she was just so much fun. Ingrid Dodd's fun too, and Vacation Ingrid is a lot of fun too.
But it's kind of the evolution, and I don't like to say mourning your single self, but it's the evolution of who you are.
Right.
And you said you want to go to bed at 9 o'clock. That's okay.
Right.
Right. We can't stop time. We just can be aware that it is going to keep moving. And then how do we find our new voice in that certain time in our life? And your doctor, your provider where you were at 20 may not be the right person when you're 60, and that's okay.
Right.
Well, that's
a big thing.
And they retire. So if you've been with that doctor from when you were in your late teens, there's a good chance if they have an established practice, by the time you hit your perimenopause, they may not be around. So you're kind of starting over. So that's a tough spot to be in too.
And I also think it's important to find practices that have that built-in succession, so that way when somebody is to the retirement time,
transition.
Which everybody should be able to enjoy their life at any point, that you've already trained and worked with that collaborative physician or NP or PA that's ready to take over that patient load.
It sounds like the new institute that they're opening for women's health here in Rockville Center is Northwell has addressed that, to have a succession plan for patients.
That.
So in Rockville Center, we have a center that's going to be built for women's health, pelvic and breast, right? So we've kind of talked about that a little bit, where every organ system that addresses your pelvis, there will be a provider there in all stages of a woman's life. So even for women that have had children and the changes in the pelvic floor therapy can be really effective for them. Mm-hmm. So I think thinking about this in a more broad way and knowing that a women's center can help then drive what women need at one place.
That's like a godsend.
Yeah,
I think we need a field trip when that opens.
Yeah,
we really do.
Yeah.
Because who has
We
the
need a field
time?
trip.
You're running from this practice to that practice. You're waiting for an appointment, and then you are the one trying to keep it all together.
Right.
You know, like I've told people, keep a little book like a journal with your reports, your blood work from here, your blood work from there, because typically you'll have to go from this provider to that. Now you're looking on your app and you're trying to show him the blood work if they're within a different, Northwell system versus Mount Sinai, whatever. So having everything in one place is so incredible.
Yeah, that's so exciting.
We're excited.
And now, will you be there, or you'll stay in your office in Lynbrook and Garden City, or what's the deal?
I will stay in my current situation because it's really focused on a lot of surgery. And so that's what we're going to...
Do you do surgery?
I do surgery.
I have an anatomical question.
Wait
Yes.
a second. What kind of surgery do you do?
I do a variety of surgeries, although I spend a lot of time administratively and doing more advocacy work, leadership, but I do C-sections, I do hysteroscopies, I've done hysterectomies,
Wow. Okay.
cyst removals, tubal removals.
Amazing.
You do it all.
Well, I don't know about all of it. I should definitely do no neurosurgery. We have an amazing neurosurgery and transplant team. They can stay there.
That's for next week.
Question
Yes.
for you. Fibroids, really common.
Yes.
Really common.
Yes.
And they say that they'll probably shrink when you get older or after menopause. I'm carrying one around for years that's the size of a 14-week pregnancy.
Okay.
I'm planning on keeping it. It's not
Is it
bothering
kicking?
me. It hasn't kicked yet, though it kicks my
Phew.
bladder.
Yes.
It kicks my bladder. And, and sometimes I will feel bloated. I will feel things because it is something that's in there.
Sure.
Is that something, and I know every person's individual, but is that, I've had doctors say, oh, you've got to hurry up and have that removed. Do you see people that keep fibroids throughout their life and they're fine?
Yes. And there are different locations where fibroids can be. So first of all, what is a fibroid? So your uterus is a ball of muscle, and the average size uterus is about the size of your fist. And the cells wall themselves off and make a little ball of muscle in the uterus, and that's a fibroid. Specific type of cell that is in the uterus. Is it in top? Is it in the cavity? Is it next to it? Different locations. But if it's not growing and or causing other symptoms, bleeding, pain, they are hormonally responsive in general and can get smaller in the menopausal state. Now, 14 centimeters is not going to go down to
What they said was
0.
equal to a 14-week pregnancy. I think it's 9 centimeters.
Right. And so for that perspective, if it's not bothering you and it's not growing, do nothing.
If it's not kicking, you're good.
It's not kicking.
Leave it alone.
Fibroids are super common, right?
Super common.
So common.
And with this new Rockville Center space that we're building, we'll have a lot more about fibroid education, how we can integrate multiple services. And I'm very excited to come back and talk to you about that, because that's a whole other conversation.
People hear they have this and they get really scared. Because people call them fibroid tumors.
Right.
But they're not, I mean.
Tumors are growth.
Right?
Oh,
Right.
okay.
So any growth.
And
People
so
be
we learned today, I
scared.
just learned that they don't necessarily have to come out
Correct.
based on.
Symptoms, size, fertility. I mean, there's a laundry list of things.
Interesting.
But then the other thing too is people should know that there's a difference between a polyp and a fibroid and an ovarian cyst.
Yes, and people are
Okay,
so
what's the
confused
difference?
about that.
Right. So the fibroid is that ball of muscle in and around the uterus, which is a ball of muscle. Then the ovaries, which are on the sides. Again, we need pictures flashing. Hormones, and you can get a cyst, and there's different type of cysts, which could be a fluid collection. If people are Googling it, sometimes they're fat or hair tissue that could be in that ovarian cyst. It's called a dermoid. Some of
But they
them
can have teeth, right?
correct.
Oh, stop it.
I swear
Yes.
to God.
What do you
Oh, yeah, the
mean?
hidden twin.
What do you mean by that?
Yes.
So literally tissue
Yeah.
that is related to fat development, because our ovaries are amazing, right?
I don't know how
They
amazing
create
that is.
life.
They create life. It is, but whether you have that developing, so there's different types of cysts on the ovary, and most of them thankfully are benign. If there's any concerns, we can see things or suggest interventions if there's something that looks abnormal. So you've got the ovarian piece, and then a polyp I like to describe as like a big skin tag in the uterine lining, because it's a different type of tissue. And to your point about endometriosis, which is another important topic that our center is going to be able to really handle, is that endometriosis means the lining of the uterus outside the uterus.
Yep.
So it's in a different spot.
Right.
And when it comes out the toilet with your period, great. If it's in your pelvis or someplace else, it can be very painful because of patterns of bleeding. Again, not going to get into all that, but essentially a polyp is a lining of the uterus, your fibroids in the muscle, and then the ovarian cyst is on that side structure.
So I think we need to have another episode about
important to know.
endometriosis.
Fibroids, pain,
fibroids, yeah.
Absolutely.
I think people need to know, yes, go to your doctor as soon as you feel anything that's, uncomfortable or really, that feels abnormal to you. But, people need to know when they need to run. I had 2 doctors tell me that I needed to run in for a hysterectomy right away. And I said, no, my body. And I looked further.
One of them being the doctor that
Took out your uterus?
and it was not planned. We just happened to both be referred to the same doctor.
And I said, I'm keeping it. And that was 10 years ago. And I kept it. And, thank you, God. I mean, anything can happen, but I monitor it every 6 months. Hasn't gone down a lot, in menopause, but it doesn't bother me. So I think people need to know, to really advocate. That's so important.
Yeah, and I think
Advocate
that's the
for
reason
yourself.
why we're here, right?
Right, our
We're just-
mission
yeah,
came
we're
out
just-
of also educating the generation that's younger, our daughters' ages.
Sure.
They're all about the
Yeah.
same. We
But
want them
also
to know what to expect.
Also, just the experience. That's all. That's we're here to talk about. Just what each individual has gone through and what the outcome has been. So
And hopefully it makes people more comfortable
Yeah.
to come out and speak with their doctor and speak with their girlfriends.
come
It's
out
not
of the
a
menopause
secret.
closet, people.
Yes,
Yes.
that's
Yeah.
right.
It's okay to talk about it.
Not taboo.
All right, guys. Thank you so much for joining us on Rebranding Menopause. If you're here watching, please click subscribe so you can see when our next podcast drops. And thank you, Dr. McNally, for
Thank you so
sharing
much.
and being here. I know you're very busy, so this means a lot to us. So thank you so much.
Incredible. Thank you.
I am honored to be here and just really hope to help advocate for women, because knowing who we are and our bodies only makes things better for the future.
Yes, amen.
Amen to that.
All right, thanks, guys. We'll see you next time.
Hey, New York. I'm Harvey, proud owner of Optics and veteran in the eyewear industry. Consider this. Why would someone have a closet full of shoes but only a few pair of glasses when eyewear is the only accessory that completely changes the way you look, feel, and the way you're perceived? At Optics, Cartier, Chanel, Dior, Lindbergh headline our extensive collection of luxury eyewear. Our opticians are trained to style and fit your face to ensure that when you leave Optics, your friends will be wondering where you shop.
Hi friends, this is Dana Persico from Long Island Nail, Skin and Hair Institute. The Institute is not only the premier venue for licensing and certification for beauty professionals in Long Island as well as New York State. You can receive beauty treatments specifically for anti-aging, facials, body treatments, laser hair removal, hydrofacial. Our senior students are working in the spa. They are happy to get any of our guests ready for this special event located in Bethpage, New York at 1055 Stewart Avenue.